Medical devices need to be designed, and design being the key word there, for the patient's lived experience, not just for emotional support and being accepted by their day-to-day, but so that human error is reduced and the risk of the device failing due to inaccurate operations with the device. Designers are a part of all of that. Not only, they're not the centre of where all those decisions are made, they work alongside and advocate for the patient's voice. However, they work with a lot of other disciplines that are just as important to bring that product to life. Interdisciplinarity is the key there, and design is only one part of that bigger ecosystem, but we play a very important part, which is making sense of the patient's issues and making sense of their lived experience in their day-to-day, and making sure that all of those small wins for the patient are considered and built into the device development along that journey. We work alongside engineers, we work alongside clinicians, we make sure that the patient's voice is heard, that it is key and central to all the decisions that are advocated for and that are designed around the commercialisation of the device. So the device at the moment that the team are working on is involving a total artificial heart, which is obviously pioneered by Bivacor. That is part of the AHFP that QUT and the University of Queensland are a part of. That device not only is an amazing technological revolution in terms of the titanium heart pump, but at the same time, all of the external components that the patient and the caregiver interact with day to day, such as the alarms, the wearables, the controller, and all of the systems that are incorporated into that housing, are even more important in my opinion, because it is what the patient actually interacts with day to day, and it's what their lived experience is shaped around. A lot of the time, the implantable device, once it's in, it is forgotten. The patient doesn't interact with that, and as amazing as these engineers are, and the pump is incredible, it is the external components that the patient and the carer must learn to use, must learn to interact with, and must adopt into their day-to-day and their new lifestyle as they know it, which is even more important in my opinion.